Hello, everyone. Welcome, everyone, to the special Lunch and Learn webinar hosted by the Center for Connected Automated Transportation, also known as CCAT. My name is Henry Liu, and I'm the director of CCAT. Today's webinar is presented by Dr. Siqian Shen, Associate Professor of Industrial and Operations Engineering at the University of Michigan. Dr. Shen also served as Associate Director in the Michigan Institute for Computational Discovery and Engineering, MICDE. She obtains her bachelor degree from Tsinghua University in 2007 and Ph.D. from University of Florida in 2011. Her research interests are in integer programming, stochastic and robust optimization, and network optimization. Her applications include optimization and risk analysis of energy, healthcare, cloud computing, and transportation systems. She is a recipient of the IIE Doctoral Dissertation Award, Inform IBM Smarter Planet Innovation Faculty Award, and Department of Energy Early Career Award. Professor Shen also serves in the editorial board of journals like IISE Transactions, Networks, Service Science, and Informs Journal of Computing. Today, Professor Shen will discuss transportation and logistics in the COVID-19 era, which is a very timely topic. Without further ado, let's begin. Siqian?
Yeah, so thank you. Thanks for the nice invitation. And I'm just happy to learn that I'm kicking off this Lunch and Learn series, and which I hope, can be involving lots of, very important topics, especially in this era. So the topic I'm going to present today is transportation logistics in a COVID-19 era. And then basically, I think, first of all, I guess, like if people have questions, I would suggest maybe we hold until the end, or you could type in the chat so that I can go to the end, kind of at end of the talk, I can go to the chat and answer them, because if I'm presenting, I can't really see like people nodding their head or whatever though. So yeah, I appreciate if you do that. So so the talk today has several parts. First of all, I will start with some overall lessons that we have seen in the past few months, from countries who are fighting the disease in many different stages, what they do, what have been proof of effective and not effective. And then the following parts touches, mostly those translation related problems during the COVID-19. So those include like testing problems, medical translation, supply chain, airline schedule management, and so on and so forth. And then I will mention a little bit about what problems people face in recovery and post-recovery planning with the conclusion. So this talk is a subset of things that are in this online document that I put together. Basically, this talks about what kind of operations research and industrial engineering tools are out there for fighting COVID-19. And I started this document about, I think more than a month ago, which is when, the number of infected cases rise pretty harshly in United States and Europe. I feel there are so many models that we have been doing, for research for quite a while, for solving various parts of these, the problems that we have seen today. So then, hopefully these, kind of like a summary type of documentation can help policymakers if they want to find some tools for making decisions. And I'm going to mention at the end that, if you have anything that you can contribute to this documentation, please let me know, and I'm happy to cite your work. And then before I start, I would like to just thank all my PhD students, the formal and actually the current ones. A lot of these faces here, in fact, some of them already graduated, but then they are like big help, big source for me. In fact, this time, some of them, they're working in Google, Amazon, Uber. They are facing daily based real problems related to COVID-19, especially related to translation related areas. And then they have been talking to me about the issues in their work. So I really appreciate their references and share some ideas with me when I'm preparing that document. And also especially thanks these 4 students who helped me organize some pictures and slides for this talk. All right, so I think a lot of times when we talk about what we can do for fighting the disease, people be thinking about data science. And so what data science can show us, to me, is more so like some observation prediction models. So, for instance, if you go to our word in data.org website, you can find this nice picture showing you database total confirmed cases, or if you want to know daily confirmed cases by country. And you can even like zoom in and see specific several countries, what the situations are. And as you notice here, I prepared this picture fairly early, so it was in April 2nd, which is not really what's going on right now. But using these like data science information, right, and you can update your information in a database. You will observe different patterns. So using these patterns, you kind of know what stages of the disease outbreak you are, and correspondingly what problems you need to solve. So these data science tools are very powerful. For example, using what I just described, researchers find that there is exponential growth if you don't do any kind of like mitigation strategies. And then this is sort of like the plot for major countries, in terms of their infected cases in the past months. And then you can see that countries who did, kind of like a severe intervention, they were intend to be not having exponential growth. But using, certain patterns that you see, then, you can build a website to predict what's the future, kind of like estimated cases will be, and so on and so forth. So these data science tools are super important because the models I'm going to talk about later are going to use data. And then the accuracy of the data you use and parameters you set will highly affect the solution you produce. So data science is definitely a very important part when we talk about like modeling later on. And this is just a website showing you that there's a group of epidemiologists in Michigan who have a website. In fact, you can navigate yourself. That it shows you trendings in Michigan. Okay, so the talk I'm focusing today is mainly the decision side. So you have the data, you have certain predictions, and maybe you can use more sophisticated way rather than like plotting the picture to show you what would be the trending looks like. And now with those data, what we can do. So industrial engineering, system engineering, translation, researchers have been putting a lot of effort in the past to, kind of design models for this purpose. So the first part you can think about is testing facility location design and testing kit distribution. So we cannot emphasize how important, kind of like testing are. We have seen many cases that if you do testing well and you design the system well, you can, battle a disease pretty well. So I would like to first mention just a very simple model in industrial engineering called facility location problem, FLP. So this model basically says, if you give me a network and then these little people represent my demand. So this is used in retailer industry, saying, if I want to build a warehouse or I want to build my production facilities, production plants, where they should be, given that I have limited budget. And then the constraint here is that once I build this facility, they have certain capacities, and if I use them in a database, I will be able to satisfy my demand. So the total cost here will be how where you locate the facilities, and maybe there are some opening costs related to that, and also the database accumulated translation cost. If you put this problem in the context of COVID-19 testing facility location, basically, given that there might be potential testing demand, so people who are infected or they think they may be infected and would like to get tested, where the location should be so that you can hopefully make them the most convenient to travel to these locations. And also in the long run, if you have facilities that are producing these test kits, how you're going to ship these test kits to these facilities and later from this facility to the labs. So you want the total shipping becomes most convenient. So this kind of like problem normally are formulated as something we call integer programming or mixed integer programming. The key here is that you will have some binary variables here because you need to know whether or not you want to open a facility in a certain location. So do I have the CVS or Walgreens or Walmart parking lot to have a testing ability? And if yes, then what's the size? So these binary variables will help you to achieve that. And then you are going to model the relationship in terms of, did you satisfy your demand? How do you ship the test kits to these facilities through linear constraints? And then this particular model could be useful. And then we see that, you know, some examples being used in Singapore in a very early stage, in fact, you know, even before the outbreak took place in Singapore, they already use some models to design the facility locations. And then with that, there's some prediction of that about the demand, and then they choose certain places to allocate capacities for testing. And in fact, this information can even be released online to the public so that they can search where are the nearby facilities, and then they will be able to go to get tested. So as I said, you know, like if you want to build a mathematical model for a certain purpose, normally we ask 3 questions. What do we know? What's the input data? So in this case, I would like to know what's the potential number of infected cases and population density, their characteristics, you know, demographics, information that will affecting my, you know, objective or affecting my constraints. And also, I would like to know the travel distance from manufacturers to potential facility locations and to individuals. The second part is what you can do. So the decision variables, what are the decision variables involved here? As I was mentioning, you can say locations are one of your decision to make. You can also say, I want to decide the capacity in each location, or the capacity is given because the facility is already being, you know, in place. Like, you know, you can't allocate that many to a small CVS anyway. And then you need to decide the shipping volume between manufacturers and potential facility locations once you choose them. There will be also the goals here. And again, you know, there could be multiple objectives. I just put 2 here, shipping cost and also travel convenience. For questions related to facility location, I would suggest, you know, one of the sort of like a seminal book in this area by Professor Mark Dasking. So this book basically contains a lot of different models, location models. So there are p-median problem and many other problems that are variants of facility location that you can consider for different problem contexts. So I do see a Q&A pop out. So there is a question about, I want to know more about the minimizing cost of formulas. So here, basically, you know, like it depends on the decision maker's objective. As I said, there are 2 objectives you can think about from the individual side as well as from the government operator side. But there could be many more. Basically, these will be integrated. So you have like travel convenience, which is not exactly cost, right, in this case. So we have been hearing a news in Germany that basically, I think earlier phase, Germany did very well in terms of where they put the testing location. And one of the news I read was that they put those locations in in certain places that the public don't necessarily need to use public transportation to go to, so they can walk there. And that will sort of like reduce the cross-infection that can be happening if you use public transportation. So I think, as you see here, the objective here has a FI for every location I as the cost associated with opening the facility, and CIJ associated with, you know, if you decide to use this facility to serve certain locations. So all I'm mentioning about in terms of the dollar, in terms of the travel distance, everything can be cooked together into the CIJ term. And then again, you know, it doesn't have to be that way. You can have multiple objectives, and then you kind of like take weights on different objectives and cook them into one single objective. So that's usually the normal way of people doing the cost estimation, right? So again, like for facility location, I think it's very important. What I feel the researchers also need to do is, instead of building these mathematical models, it would be nice to deliver some sort of like user interface. And again, I'm using Singapore as an example. There are many testing facilities. In fact, first of all, that's a very kind of like big capacity to use for a small country like Singapore, and that's how they can get their disease under control quickly if there's anything spotted. The other things is that these figures and everything, the public can see them. So it'd be nice to have something like that in United States if we prepare the next wave of the COVID-19. On the other hand, I do have another article online that talking about having massive testing in United States, like countries like the United States, may not be realistic because we have very complicated demographics and also large population as compared to like Singapore, South Korea. So the other thing to think about is group testing and also selected groups, like who other population groups to prioritize and so on and so forth. But that's not related to translations. I don't include that here. The other things I would like to mention is the model I was just showing you, which is not time index based. In fact, for this kind of like application, I do feel that like considering time is meaningful, especially we are facing so many dynamics here. So you can easily extend a facility location problem into a multi-stage setting, and when you do that, one of the things that may happening is that you may not some parameters value in your formulation. So for instance, I need to know the DTJ, which is the demand for time t in location J. And that to me is an estimated number. And you can plot in the estimated numbers of the model. But the other thing that you may consider is using something we call multi-stage stochastic programming or multi-stage robust optimization. So in that way, the facility location decision is being made over time. So every time you need to decide, do I add a new facility or do I close the current facility? And then you can kind of like adapt your decision to the demand forecast that you build through these data science tools. There is a paper I put it here, which is not exactly facility location, but it talks about the dynamic feature of the resource allocation for epidemic control in multiple populations. And this was a paper published in 2002, very early. And the model is very generic, but it can be modified to adapt in many cases. So I just touched on the testing problem. There are many testing problems out there that like we can probably discuss offline. But then I also want to kind of mention other translation problems that you may see, just to have a more like a broader sense in what we can do. So the other part is related to medical translation problems. So translation systems that particularly serve medical purpose. So the first thing you can think about, of course, is ambulance. You have so many, ambulance allocated in different places. And then you get like phone calls from past patients. So in this case, you may have, various type of patients with the infections like at different stages. So they may be like mild symptoms versus very critical symptoms. The question here is, how do you dispatch your ambulance? So if we just get a call and then we dispatch one ambulance, we may run into a situation that because of the high demand we have, we run out of all the ambulance. Everything is out for service. And then basically, like if there is a very critical patient now calls, you don't have any ambulance to serve them. So this is a very interesting problem. It involves uncertain decision-making under uncertainty. And then it's very relevant to COVID-19. And on top of that, in fact, the facility location of ambulance itself is a very interesting problem. Where do you place the ambulance at the first place is interesting. So a common methodology in this area, and again, this area has been, kind of like investigated for quite a while, mostly by certain researchers like, the one I'm citing here, Laura Albert in Wisconsin. So she had a series of work in, kind of like ambulance dispatch under emergency. Basically the tools there are mostly something related to mixed integer programming model, because the constraints here are very complex. So somebody, kind of like raised a question before when I was talking about something related to this in another talk, like, can we use something like, Markov decision process? The answer is always like, for modeling tools, you can use whatever you want in general, right? If you can model the problem at the level of the complication that you're facing. So, if you use Markov decision process, basically you can do you can design your action, and you can have the state of your system. In this case, the state of your system is pretty much the level of the number of available ambulance you still have in different locations. But the problem here is that if you want to model the transition probability from one state to the other, given certain actions you take, it may not be that easy, because there are many, kind of like interactions between, the ambulance dispatch decisions and other things in the system. So normally, if you want to specifically model these, kind of like complicated decisions, says, where do I place my ambulance? How many ambulance I have now for every time period, right? And you keep track of those. And also you want to prioritize ambulance for different types of calls. So at the beginning, you kind of like give a priority to the calls, and then try to satisfy these priority constraints. And eventually you want to have some load balance constraint to say, if I dispatch the ambulance, it better go out of my node. Then, I have this like flow balance to maintain. With all these complications, normally people do mixed integer programming model for this type of problem. And then you just need to, improve the solver's performance to make sure that it can handle this big size problem. And normally you will solve this model like every once a while, so that you can refresh your system. So basically, there are a list of literatures that, like as per like, Laura Albert has been developed, that I recommend you to read the paper she has, and many others has. The other type of problem, very relevant under COVID-19 is that, can we do healthcare at home? Especially for a lot of patients, like chronic disease patients, elderlies. These days, if they go to hospital, it's very dangerous. And a lot of cases, in fact, that I've been reading in early phase in Wuhan, is that people get COVID-19, like coronavirus, when they visit hospital. For other kind of, like elective surgeries or whatever, because people didn't realize that a cross-infection is a very important issue here. So medical home care delivery has been talked about a lot in the past. Basically, like you want to design some trip for the certified nurses to go to your patient homes and serve them. So this particular problem is in fact similar to all these, vehicle routing problems that we have been dealing with, right? So if you want to see how to build a model, we would like to know, okay, what would be the input data? So in this case, I would like to know where are the healthcare providers' information, where they locate, what their expertise are, and so on and so forth. And what my patients' information, what kind of, treatment they need, and their locations. And then my decisions will simply be, how do you match these medical care providers with your patients? And then once you match them, you also have very specific, kind of like a schedule you need to give to individual tools, right? So how do you route these service fleet to assigned patients? So these are all, kind of like decision you have to make. And then, after you have this basically a route, you have the timetable, you can tell both sides what time they need to go where. And then, like for the patient, what time they expect someone will visit them. And the goals here, again, there are many objectives that people would like to achieve in this kind of system. System efficiency can be, kind of like interpreted in many ways. So in here, you want to match the best pair of the, patient and provider. And so that will give, some sort of like a scores in terms of how well their expertise matches each other's needs. And then also the minimizing the routing cost of the assignment. I just list two here, but it could be also, you have an uncertain system. So the operation may not go as well as you thought. And then some patients take longer time than you think. And then the later part, patients will have to wait, or the system become too idle if you don't have enough patients. So those will all can be integrated into your cost model in terms of, I want to minimize the total waiting time, minimizing the total idle time of the system, and so on and so forth. Okay, so this is the medical home care delivery problem. All right, so as I said, this problem has been, kind of like solved in translation for quite a while. And then the overall model is called vehicle routing problem, so VRP. And I just present a very kind of a generic version of VRP here. It may not, fit the problem context I just talked about before, because you may have like time windows for the patients and so on and so forth. So there could be like a VRP with time windows. You may have capacities for each of the vehicles. And so you have a capacitated VRP. And then there could be some sort of like pickup and delivery problem instead of medical home care. So you can, in fact, you can do, kind of many variants of this type of VRP problem by adding additional constraints to it to give more information, say what's the timetable and so on and so forth. But basically, like VRP, and then if you want to know more about VRP, this is a book by Toss and Powell and Viego in 2002 that summarize a lot of models and algorithms for VRP. So me and my student have done something, in fact, for this medical home care delivery problem. What we did was, find out all the, major hospital locations in Wayne County, and then see what the patient population looks like. So you can have like census data to know where the elderly live and some of the common chronic disease treatment they need. And then you can basically design the matching. So you can see that these different colors represent, which is the population that is being currently covered under what depot. So this depot or hospital is where your caregivers are going to dispatch their vehicles from. And then once you have that, then you can design like many little routes to connect these like dots in terms of the patient locations. So this is kind of like a model that you can establish, especially for COVID-19 purpose. All right. So the next one is supply chains. So we have been hearing so many things about, supply chains, crisis, the risk of related to supply chains these days. And especially there, some pictures that we see in major retailers that you have empty shelves. And then if you look at these restaurants, right, it says that I open for takeout and Uber Eats. So in terms of restaurants, they close, but then the model they run are very different from what they used to be now. And so delivery is a big issue they're facing as well. And these are all, translation related problems. So for supply chain, this book basically is one of the, sort of like, Wikipedia or, Bible that you want to read if you want to study supply chains. It's by David Sinclair-Levy and many his co-authors. So so you can kind of like get mathematical models or even like real world case studies from this book. So one thing I would like to mention, there are many parts related to supply chain. If you want to, talk about the network design problems, that was one, like what we just see in the testing, case that you need to locate facilities and so on and so forth. There's also, kind of like these issues that you have empty shelves is because of the, inventory control and management. So then, like there is a very well-known phenomenon called Bullwhip Effect in supply chain. What it has is that if you model your supply chain from the customer to the manufacturer, so as you go up the stream, what happened is that if your customer has a little, turbulence, like in his or her order, so you observe like a higher demand or lower demand, but just a little bit. If you don't have any strategy in terms of managing the supply chain and presenting the information throughout the supply chain, naturally your retailers is going to amplify this turbulence, and then your distributor is amplified even more. And eventually when it gets to your manufacturer, you're going to see a big, kind of like jump in terms of order or a decrease in terms of order, which is very not necessary. So that Bullwhip effect has been observed, many, many years ago. And then they have, kind of like written lots of papers talking about why we have this and how we can prevent this. And something that you hear recent, in a daily basis, something like safety stock. These are the terms that people created for preventing Bullwhip effect. And so you can see that why, like we have empty shelves and people get panic. A lot of times, these are sort of like the not true information being delivered throughout the supply chain, so that we can sort of like hopefully mitigate. So talking about supply chain risk management, there are very, kind of like classical models in this area. And so I list two of them. So most of the time you want to think about your inventory control and your location design together. And that can hopefully, in fact, decrease the supply chain risk. So this seminal paper by Max Shen and Colad and also Mark Daskin in 2003 is one of the, the first pioneer paper talking about the joint location inventory model for supply chain management. So the idea here is that you want to decide the inventory level at different locations together with where should I place, warehouses, and where should I choose my suppliers at the same time. There are some other things related to supply chain risk management. And first of all, if you have risk, normally it's because you have uncertainty. So the stochastic word you will see a lot in supply chain literature. And then those are usually these, sort of like uncertain demand that you may see, or the lead time that people may get things to you and stuff like that. And then in this case, how you can, kind of like mitigate the risk. So the idea here is that if you only have one supplier, and normally if this supplier goes, kind of like out of control, your supply chain can get very disrupted. So it's a common strategy in supply chain management to have multiple suppliers, even it may not be the most economic way, because you may just want to choose the supplier give you the best price, right? So, but then by maintaining multiple supplier relationship, you are going to pool the risk. So you can do some risk pooling. And then if one of the supplier goes with problem, then you still have multiple options. So then those are the key concepts in supply chain risk management. So the other thing related to the supply chain that we have is also this online retailing challenge. The supply chain is facing unprecedented challenge, not only because of these, kind of like uncertain demand that they have, but also the nature of the demand. A lot of people don't go to grocery shopping these days. They order things online, right? And then these will disrupt the supply chain at the same time. But just for these, online orders, how you deliver them is also a very challenging problem. And you can see that there are many ways of doing delivery these days. People have been very creative. And then each of them is associated with some certain models that we need to formulate and solve. But then, at earlier time, when, there is a surge in online retailing, in fact, if you go to these, like a major website, if you go to like groceries website, like Costco, they normally just say, we can't deliver within the next 2 weeks. Even like giant retailer like Amazon, they still face this challenge. At some point, Amazon says there are no delivery windows available. I sign up for delivery something from Whole Foods. A few days ago, they said they will notify me when I can start shopping. And I get the notification maybe like 5 days later, once I sign up. So these are all challenges. And of course, if you talk about delivery, you want to talk about who delivered to you and how do you in fact inspire the supplier side. And those questions are all very important when we have this, like problems in Uber, Lyft, that we cannot find drivers. How can you price things? How can you do something to increase the supply side? And that's exactly the problem a lot of online retailers are facing right now for delivery. Nobody are out there to be available for delivery. And then, you know, like they implement certain strategies and to encourage people for delivery and so on and so forth. And then they need to design these delivery routes and timetables. So, you know, if you want to build this model, basically, you know, again, we need to know the input data, what are the inventory levels for different things that I have in my store, what the order details, time windows for delivery, who are available for me to dispatch to deliver, and then we will need to make decisions. And then, you know, eventually you want to have certain goals in terms of operating this online delivery system. So as I said, you know, there are many problems actually out there for with different pieces, but then COVID-19 just needs you to combine all of them together, because you need to have a healthy inventory control of the products in your system by looking at the surge of the online orders. At the same time, you need to dispatch these orders to different households and solve like vehicle routing problem. So, you know, like how can you solve these models quickly? How can you not solve these models, but come up with some reliable, you know, kind of like policies that you can use in real time? These are all research questions that I think we can contribute. The next part is related to airline management and other related problems. So airline is a big area for transportation. But then, you know, as you can see these days, there's so many problems solved in a daily basis in airline needs to be resolved and resolved quickly, because the demand just, you know, kind of like changed drastically. We see a big decrease in terms of the, you know, like airline travel. And then on the other hand, in certain locations, then you see like a big jump, because, you know, if a country, this is a picture in Dallas airport that, you know, once US announced this travel ban between US and EU countries in early March, and then all the people just all of a sudden fly back to the US and they jam into the airport with a lot of risk exposing to the virus and so on and so forth. So there are many issues that we need to solve. For airline fleet management, normally the problems I listed here. You need to design your timetable, airline schedule. You need to design the fleet assignment, what kind of airplane goes to which flight. And then, you know, there's aircraft maintenance problem. Some airplane needs to get maintained, and then you need to pull them out of the schedule. And you have crew scheduling problem, how to assign pilot and flight attendants, and also some OD pair control. These problems, as I said, you know, they were solved for a long time using, you know, mathematical models like this, integer programming models. And then because of the, you know, kind of like a big size they have, some approach, very popular approach, has been invented for the purpose of solving them. And then now they become very popular, like column generation. So I list some papers here that you can take a look at, you know, like what people have been done in solving airline related problems. But as I said, you know, these days, what we see is unprecedented, the demand, and then how rapidly things change. And also a lot of like air control problem in different countries, like, you know, what kind of airlines they can fly into certain country and so on and so forth, all add a very complication to the models we have. So how can we actually solve these models quickly is a key. There is also the picture I was showing you in terms of you know, how crowded the airport can be. The problem is that you can actually solve a lot of these issues first, right? So if you are going to announce travel ban, it's better that you have certain policies in place in these airports so that you can avoid things like that. So one of the research people have been doing is called multiple level passenger screening. And the original purpose was to serve the needs of, you know, kind of like after 911, you want to screen passengers, you know, each of them, but then it takes a long time. The goal is to identify the potential terrorist, and then so how you can design a multiple level screening system so that you can maximize the chance of catching the terrorists, but at the same time not screening all the passengers through all the steps. So, you know, as a result, you can see that TSA pre-check, clear, these are all the things that we can do in terms of, you know, kind of like pre-screening certain people, and then they don't jam in the airport. So a lot of things that, you know, like airport are dealing with nowadays is, you know, like who may be the potential virus spreader. and then how can we identify them? So these will be related to these, kind of like a multiple level passenger screening system I was talking about. So all the models I was mentioning, translation related models, in fact, if you customize them for certain population, in this case, I would like to mention the underserved and low income population, they are going to be different. Like there's certain part of the model we design needs to be different for these populations. So I just put out a few things that I feel the news is there. We really need to help these populations. And then, what we can do, right? So one of the, the models that I was mentioning in terms of like a food delivery, grocery shopping delivery, you can do that for like, for instance, the food distribution plan in Ann Arbor Public School. And I know that because I was following the Ann Arbor Public School news that they're delivering free lunch to people who used to get free lunch in school, but now they don't have it. So they still cook it anyway and use like school bus to deliver to families. The issue here is that you can't have that many stops to drop free lunch to certain family just because the time is very short. You have to deliver everything within, like 11 to 1:30 as a time window, and they don't have enough school bus drivers. So there are a lot of like research needs to be done in terms of how we can combine locations for, delivery, how often we should deliver, what would be the route to design for deliver. And then, there will be some sort of like a last mile delivery problem that the family either needs to travel and pick up the food or whatever. So yeah, so I think a lot of models we mentioned before can focus on these populations as well. This is very brief and it's the last part of my talk. The problem we were talking about is all, kind of like emerging and happening right now. But think about if we have the disease under control, hopefully soon. And then there are a lot of issues as well that related to, kind of transplantation. And that's what we see in China nowadays. Even they have the disease being under control, just because the nature of global economy and everything, you have to deal with those problems afterwards. So how to continue allocate and distribute essential hospital resources? How do you track reinfected patients and then monitor their the travel they have? And then how do you control inbound flights from different countries? How to adapt to new consumer behavior and travel behavior when you start solving your, previous travel models, Uber, Lyft, whatever. Do people still want to do ride sharing? There's a lot of like research questions we have to face. And then, for these problems, I feel if we continue using these facility location queuing models, integer programming, vehicle routing models for this problem, and hopefully things will get better. So with that, I think this is my conclusion slide. Just from data to actions to solutions. I feel if we see the data, that's good, but then we still have to do something. And then one of the things here is that, you can see how quickly a disease goes up. This was marked in March 23, and that was only 300K cases globally. And these days we know that, like we have 3.7 million infected cases and 260 deaths globally, and then about a third of them are coming from the United States. So then, like there are very important things that we learn from, other countries in terms of the lessons we can do to avoid the spread of the disease and to hopefully mitigate that and control it. So then, like I think a lot of things involving these lessons are translation related that researchers can do. So yeah, I'm happy to answer any questions. And thanks everyone for listening. I think there is a Q&A and there is like a chat. So Do we have any questions in the chat? I don't
This
think
is
so.
Henry.
Okay.
I don't think there's question on the chat, but I do have a question,
Okay.
Siqian.
Yeah.
Did you mentioned several models, the testing facility, location model, and then largest supply chain models, and any of these models have some applications, real application in Michigan locally to us in this time?
No, not at this time. So I think the real problem I see actually have been used, you know, like the models we design, in fact, used by people is this another public school food delivery system I was mentioning, right?
Okay. Yeah.
Because I contact them. In fact, I say, you know, I have some expertise. I know that they have been delivering food, and I talk to them, and then I say I can, you know, help out and just, you know, do a model or software for you. But in fact, they say they have this company, they do this school bus scheduling problem for them. So then it's very natural for them continue to do this, you know, kind of like a lunch delivery system. And that company basically use all these, you know, vehicle routing models that we have. But that's like the only real application of the models I know being implemented in Michigan. And it's only in Ann Arbor. I don't know any other public school actually have been constantly doing that. And then they are very impressive. So far, I think I follow their Twitter, and then so far they have been delivering, I think, like 250,000 lunches in the past 2 months. They just like have volunteers, you know, do that for them. But then, yeah, I said, I think, you know, a lot of these models, if we can have them in place somewhere and then raise the awareness of the policymakers, you know, they may use them.
All right.
Yeah.
Calvin, do you see any questions from the audience?
I'm not seeing any, no.
Okay.
I see several in the Q&A part. So there are like 2 panels. So yeah, one of the question is, do you know here in developing countries, we suffer from the people attitude? And I need to know how to apply these models in shared mobility here in my city. It would be nice sharing your teamwork. Yeah, so we're in the process, in fact. So I'm working with several of my PhD students and also some undergraduates in COVID-19 related problems this summer. So our goal here is, you know, we want to eventually build a website. And so right now I only have this, you know, kind of like several articles about what we can do, but not like real formulations and stuff like that. We're in the process of building that. What we want to do is eventually on that website, you can see summary papers, you can see, you know, little software you can download and play and enter your city's problem, and then just like hit solve, and then it will give you some solution that you would like to have, and covering different things that I mentioned in this talk, and maybe some other not translation related problems. And hopefully there can be also some games that, you know, people can download and then give it to kids to play, so that they know, you know, how important these decision models are for controlling virus. But I do feel like there is one things that this person mentioned in terms of the people attitude that I didn't mention a lot in my talk, is that the traditional models we develop, we kind of like treat, you know, social behavior or people behavior as more like input data, right? If we say we don't know what people is going to react, we're going to model some uncertainty in my demand. And then that uncertainty is going to be following certain distribution, whatever. First of all, for COVID-19, we don't really have a lot of data to tell us what that distribution will be. So a lot of times, you know, our decision is made as we observe. So one example I can give it to you is this testing problem. So you want to use the testing to say, how can I, you know, design a good testing to treat, you know, hopefully cover all the people who need tested in this certain area. How do you know, where they live, and then, their certain locations? We rely on the data from testing. But then at the very beginning, your testing is not enough. So then, like the data you're going to see is in fact a highly biased data that is going to not reflect the true distribution of your demand. So then, this is very iterative process. Your decision being made, and then you observe the data, the people's behavior, in fact, will change as they see your decision. And then they may choose to do go testing if they get a virus disease, right? And then, or, you know, like if the, you know, the government doesn't, you know, kind of like try to control the social distance, they may be saying, you know, I would just stay home and cure myself. You wouldn't be able to observe that data. So I think a lot of times, you know, how do we rethink our model is how we can incorporate that part of the endogenous uncertainty into our current model, which means that the uncertainty is affected by your decision. So unless you make a decision, you wouldn't be able to observe that uncertainty. And of course, you know, that's going to be introduce some machine learning process to the existing optimization model. So that part I think is lacking in the traditional model that I try to summarize in my document. I say, hey, we have done so much, you know, you should use our model. But I should be fair that I do think that our model is not perfect for solving the COVID-19 problem now. And we do need to adapt other methodologies like reinforcement learning, you know, data science, other parts into the existing model to treat the virus problem. Yeah.
Well,
okay, thank you. Yeah.
Very well. I don't see any. Oh, there's another. There's another question.
Yeah, will virus spread concerning of delivery will change the optimal decision much? It is. So I think a lot of also the delivery problem that we talk about. I didn't say, do we have enough, you know, people to deliver? The answer is in fact no. And I mentioned that, you know, there are a lot of other models we need to do, in fact, you know, in terms of pricing or what delivery protections we can have in place to encourage more people who want to be a deliverman. Because that will restrict how well we can design the timetable for delivery. And the other things are, you know, like, will people be accepting delivery? And then I think the current situation I see is that people are weighing the risk of going to the supermarket versus deliver at home, because they know that somebody who is a stranger is going to deliver still. They know that this person may be carrying a virus. But I think, yeah, I know like in China, they do this, you know, kind of like temperature tracking of your deliverment. So in your app, you know what the temperature of the person is. I don't think that can be done here because of the, you know, kind of some sort of like privacy issues. But I think a lot of things are being done to mitigate the concern so that more people will use the delivery. And I think, you know, I use delivery anyway. I just like leave them outside and then clean, you know, kind of like wipe them, clean them up before I eat them. So yeah.
All right. Thank you, Professor Shen, for sharing your work with us today. That's very informative. And thank you everyone for joining us for the special Lunch and Learn webinar. Our next event is our research review, scheduled for Tuesday, June 2nd. Dr. Shan Bao from Armtree will be presenting her research project that focuses on eco-routing navigation systems and the impact on driver decision-making. And you can register this event at ccat.eventbrite.com. Also, please be sure to follow us on Twitter, LinkedIn, and YouTube. And this event is actually streamed online at YouTube also. You can watch the upcoming event as well as watching previous events, including our global symposium on connected automated transportation in April. Thank you again and see you next time.
Thank you. Bye.
Thank you.
Bye, everybody. Thanks, everybody, for listening.